Now, we did reach out to the ICMR on COVID testing, and I think it's important that we read out what the ICMR has to say about the two different types of testing. They say symptomatic individuals who test negative for COVID-19 by the rapid antigen test should be definitely tested sequentially by RT-PCR to rule out an infection, whereas a positive test should be considered as a true positive and does not need reconfirmation by the RT-PCR test. Well, let's focus a little bit more on this. I'm joined now by Atishi, the MLA of the Aam Aadmi Party and spokesperson as well. Besides anything else, Atishi is somebody who's better now. She's recovered from COVID, and that's a relief to all of us who who look upon her as somebody who's really been inspirational in so many areas. But Atishi, why don't you tell us a little bit about this discrepancy in numbers that we are seeing as far as testing is concerned? Now, there is enormous data around the world which suggests that RT-PCR is the gold standard. I understand that you need to do quick tests in Delhi, which is why you're using the rapid antigen tests. But the fact is, the number of low positive cases in rapid antigen tests, is that not a worry for you?
So, Vishnu, I think two things we need to understand when we are looking at rapid antigen. So, when we do RT-PCR test, if you see that there is a limited bandwidth that labs have, and RT-PCR is a complicated test process. It involves extraction of the RNA from the swabs that are taken from the patient, and then after that RNA is extracted, it is processed and then it's tested. There will always be a limit to the number of RT-PCR tests. So what was basically happening? That with just the test capacity of RT-PCR tests, we were only able to test those people who were developing COVID-like symptoms, and they were referred by doctors, be they government doctors, be they private doctors. They were getting referred for RT-PCR tests. But the fact is, we also know about this disease that there are a lot of asymptomatic carriers. And to do any large-scale testing on the field, in containment zones, in what we know are high-risk areas, etc., it is not possible to do such large-scale testing by just focusing on the RT-PCR. With the RT-PCR, we can only stay within the range of maybe about 3,000 to 5,000 tests per day. And with the antigen testing, the amount of testing can actually go up to 20,000 to 25,000 samples per day. And now with
the question that arises, I understand that the limitations that you're talking about. However, is there not a real worry that if you are using a test which is unreliable in the large number of cases, particularly on people who have the most minuscule symptoms, which could be anything at all, not necessarily COVID, they turn out to be negative when in fact they are positive, they're out there in the open believing that they're absolutely fine, they enter workplaces, they enter shopping centers or whatever it is, your neighborhood market, and they end up infecting people who are vulnerable, right? I mean, is that not a real worry?
So I think we need to understand two things, Vishnu. First of all, anyone who is symptomatic, even if their symptoms are mild, and they test negative in the antigen test, are sent for an RT-PCR test. So anyone who is symptomatic, yes, they are sent for a further testing. And in Delhi, that number is actually, interestingly, we found is not more than 5 to 7% who are symptomatic and have to be referred to RT-PCR. So that's number one. That's an encouraging number.
Okay.
Number one. Second, I think what we need to understand is that as far as Delhi is concerned, the data about lowering number of cases is corroborated by two other data points. One is the number of hospital beds that are currently occupied, as well as the number of deaths that are happening. So even if we assume that for whatever reason, our testing data may be showing up wrong data, and we are seeing that trend, we are not capturing an accurate trend of the reducing number of cases. But if a patient is sick, even if they are suspected COVID patients and they have not yet had a test, any kind of patient who gets a severe symptom lands up at the hospital, whether they are tested or whether they are not tested. But we can see the fact that from about 24th June onwards, hospital occupancy has been steadily decreasing. And now
that's
Delhi
an important
stands,
point.
Yeah,
That's an important point, because I think the argument over there is, if you are genuinely, or not genuinely, if you are extremely unwell, you have to go to a hospital, right? Irrespective
Absolutely.
of the test that you've gone through. And so what you're saying is that the footfall in hospitals of COVID cases has gone down, and therefore that is a direct indicator of the infection being at a lower number than earlier. But
And
Atishy,
not
I think
just
the question
not,
that everybody
not
wants.
just
Sure,
not
make
just
your
it's actually not just the hospital beds, even the number of deaths that are happening with anyone with COVID-like symptoms. You must realize that when we count the number of deaths, it is not just those who have been tested positive. Those who are suspects also do get counted in the death data that is coming in every day.
Okay.
And one can
Atishi,
see the fact
I
that
need
the
to
number of
interrupt you
deaths is
because I
also
need to
steadily
move on, but I have to ask you one basic question. Do you sincerely believe that Delhi has almost flattened the curve? Do you believe we are on that path now? I mean, because we've seen what the Chief Minister has said. There is this data which is, it's sort of all over the place. People want news which is accurate. What is the accurate story here?
See, I think Delhi has definitely plateaued in terms of the number of cases. The number of cases coming in every day are lower than they were. The number of deaths is lower. The amount of hospital occupancy is lower.
Okay.
The number of people in ICU beds and ventilators is lower. But I think that we should just not be complacent too soon. I think that all the core measures that need to be taken, be it wearing of masks, be it social distancing, be it all the precautions that we have to take, I think we cannot let go of those because we have seen in many countries across the world that you have seen a second wave of infection. And we do not know enough about this disease to know how herd immunity will develop, what is the benchmark by which it would happen.
And of course, there's that entire controversy on herd immunity itself that we'll save for another time. Thank you very much, Atishi, for joining us. And it's good that you are better yourself.